We'd like to welcome back today from Hayes Family Practice. Joining us today to discuss an important, very important, and certainly an amazingly, shall we say, crisis-driven topic today. Dr. Steve Waring from Hayes Family Practice. Dr. Waring, thanks for coming back. Welcome. Thanks for coming back in. The topic is opioids. Let's begin with, if you would, a professional definition of an opioid. What are we talking about, Dr. Waring?
These medications are a class of drugs that act on the brain in the same way. They can be prescribed as pills, and people may recognize them as commonly prescribed pills if they've perhaps been exposed to hydrocodone, oxycodone, Percocet. And there's a number of them, tramadol. But there's no difference between the way these medications act on the brain as morphine, which is the original, or others such as heroin or fentanyl.
Tell me about the problem as far as its expansion over the years. Why have opioids become such an important focus point for drug addictions, prescriptions, and problems?
To answer that question, I think we'd have to go back to the 1990s. Before that time, these medications were used very sparingly out of respect for what they could do. But subsequently, the amount of opioids that's prescribed per person in the United States has increased by 500 or 600%. They've become much more widely prescribed. And if we fast forward 10 years, 15 years to the present day, we are having a crisis. People that are becoming dependent on them. They've been taking them preps for years. We have young people that are getting exposed to these by prescription and becoming dependent on them and progressing to, in some cases, heroin use and deaths. And so the death rate from this has become unconscionable. We're having 110, 115, depending on the year, 110 deaths per day. And this is affecting young people, old people alike, but younger people is definitely a concern. Everyday people, it's become, as you say, a crisis. And our country is using these drugs, consuming them at a greater rate than any other country. So we have a real problem that we need to address.
So the United States basically is a focal point, and these are addictive then. Once you start on them, it's very easy to become dependent on them, Dr. Waring?
Correct. I think dependent is a better word. I think the great majority of folks are trusting their doctor is acting in good faith. But yes, you do become dependent on them in as little as 5 days. And children are much more susceptible to that.
So within that span of time then, let's say, for example, I go to HaysMed for a procedure. I am prescribed or given the opportunity to have pain relief medications. And if I am not careful, there's a possibility for overuse or abuse or long-term dependency. What's going on here?
Surgery is a painful condition. It's a painful process. Post-operative, you have a surgical wound that's going to be painful, especially if it involves bones, orthopedic procedures. Some of these are truly painful. So people aren't overusing or abusing at all. But the nature of these medications is a little counterintuitive. It's peculiar. After as little as 5 days, they can start to increase the body's ability to feel pain. And people can have their pain increase while they use the medication, or they can become dependent on the medication to get relief, and then fairly soon something that should have gone away hasn't. And a year later, that person can have a real problem.
So these types of medications can actually become less effective, so people want to take more of them to become, again, pain-free, but at the same time, they may actually contribute to the pain? Is that what I'm hearing?
Correct. The brain will reset. It will find a new normal where normal is while you're taking the medication. And without that medication, there is no normal. And that's where people have trouble. There would be a withdrawal if they tried to go without the medication. Withdrawal is dreadful. And people become trapped. And it can happen before they realize it. So there's many aspects to this.
This particular problem is something that you have become interested in over the years, Dr. Waring.
You know, I think this has been going on since the 90s, so those of us that were practicing in the 80s and saw the 90s and 2000s come along, I think we've seen this. It's a hard thing to solve. It's very difficult. These are extremely difficult conversations. I think what we're trying to do across the country, in Kansas, at Hayes Medical Center, is come to grips with this in different ways. We are using evidence-based statistics research to guide us in treating pain in other ways, to prescribe less opiates. At Hayes Medical Center, for example, we have pilot programs for post-op pain that involve using other medications, other procedures, and not using opiates. And the research has shown in other places, and we're reproducing it here, that the surgical results are better. People recover quicker. They actually have less pain, not more. And so we have that initiative to prescribe less. We're trying to, and I think this is very important, what I'm involved with right now is trying to get opiates back out of the community. So those of us that had a cesarean section or a knee replacement or some procedure where we got a bottle of 30 pills and we use one or two of them, and they're in the back of the medicine cabinet, I think that there's a lot of that. So we have initiatives to take those back, if you like, and there's various resources in Hayes that I think people maybe don't know about. Mm-hmm. And finally, we have to help those people that have painful conditions, and how can we manage those in a safer fashion, because people are taking opiates at enough medication that there's a statistical incidence of death that's unacceptable. So many per year. And that's something we have to address for safety.
Matter of fact, I saw a report here a while back, not too long ago, that deaths from opioid usage has now surpassed deaths from vehicle accidents.
Correct. In some age groups, opiate deaths are now the most likely cause of death, exceeding car accidents, exceeding heart attacks, cancer.
And you mentioned 110 to 115 daily
in the country.
In the United States, are dying from opioid usage, addiction, overusage, whatever situation it is.
Right.
We're going to get into the methods of control, I guess, that you've focused on here just a few minutes ago, Dr. Waring. But I wanted to ask you, if we could, this cuts across all age groups, because young people, not only with access to unused pills, but even young people who are prescribed medications for, say, sports injuries or other situations that they might, see a doctor for, can become addicted as well. We're talking about all age groups, aren't we?
Absolutely, and young people is a great concern. People of all ages. If you're a little bit older, even then, the risks of death increase with the doses, increase with age, increase with the use of other kinds of medication like sleeping pills, multiply the death rate by 10 if combined with opiates. So and I think we have to start where we can do the most good. What about helping getting some of these medications back out of the community so they're not there? One statistic that I think we need to be aware of, and I think this is happening, I know it's happening in Hayes, is that 1 out of 7 high school seniors has used prescription opiates in the last year in a non-medical fashion.
1 out of 7.
and these are extremely addictive.
And this would be high school, middle school?
This is high school seniors.
High school seniors.
I suspect that number. I don't have the number for university, but I suspect it's higher.
Uh-huh.
And I think it's important to know that this can lead to addiction and can progress to some very serious things.
We were talking earlier before the program about the vaping situation. Is that a component of addiction problems that maybe young people are being exposed to now?
I really feel that it's very similar. The industry that produces this product is similar in dynamics to the industry that produces the opiate product. They literally advertise this in various ways. For vaping, it was advertised as something that was safer than cigarettes, but they've made a product that's comes in it's the size of a chiclet, and it contains enough nicotine that's equal to 26 cigarettes, with flavors like mango, bubblegum, and it's highly appealing to children. And so they're clearly targeting children. Again, they're uniquely susceptible to becoming addicted because of their age and the age of their brain. And then they get a lifelong client and make money. This has become epidemic again. We have an 80% increase in the number of high schoolers using this product in 1 year. We have a 54% increase in the use of these e-cigarettes, juuling, as it's commonly called, in middle school.
54% increase in 1 year's time in middle school.
Correct.
And 80% increase in high school in 1 year's time.
Correct.
As far as the opioids, let's get back to that for just a moment with Dr. Steve Waring from Hays Family Practice. By the way, at Hays Family Practice, are you still open for seeing patients? Do you still have some room available?
Yes.
Okay. Just wanted to check on that. And flu season. We always like to ask our docs about flu season. What are you seeing?
We're having a lot of activity in Kansas. I haven't seen a real tremendous spike in Hays. I don't know that this year is going to be a real serious year. We occasionally have a year that's very bad, but it's not over yet. We just don't know.
Okay. Dr. Steve Waring from Hays Family Practice, which, by the way, has the newly remodeled facility. It's just fantastic. Right across the street, right across Canterbury Drive from the HaysMed main campus area. It's a beautiful facility and certainly well-staffed, long-time part of the HaysMed facility now. Hays Family Practice with Dr. Steve Waring. On the opioid situation then, where do we start? You've addressed a little bit of this. Where do we address the problem? It seems like it's going to take a lot of involvement from a lot of different areas. Talk about that a bit, would you?
I think we have to use the evidence to reduce how much we prescribe. So we have multiple other medications. There are literally 5 or 6 different kinds of medication that we can use alone in combination to help with pain. We have procedures, injections, sometimes very complex procedures. Our anesthesiologists are very skilled in administering treatments by injection to nerve roots or spinal cords or trigger points, etc. And a number of other things, physical therapy, chiropractic. There's a lot of modalities that can be used to help. So we have to reduce the amount that we prescribe, improve the take-back, and help people that have existing and chronic problems manage them better.
All right, so it begins then with the prescription. HaysMed is now actively involved in new modalities, right, Dr. Waring?
Correct. At Hays Medical Center, we do have a lot of expertise in treating pain at our pain clinic with injection therapies. That's not going to solve some of these problems, but it can be one of the ways that we address it. And again, I think this is a work in progress and it's going to take some time. I think one of the key things is to educate and improve awareness And so the listeners, I want them to understand that there is a problem, that there is a crisis, and that there are ways to deal with it. We want to be aware that our youth are especially prone and susceptible, and we need to be more aware so we don't have any of those tragedies happening, or not as much, hopefully.
All right, let's take that point then and move to that about addressing the issue of usage. And the patient receives a medication after a procedure. What is their responsibility? What do they need to do to make sure that, first, they don't become addicted, and then secondly, that should there be leftover medication in the form of pills and such, that those pills are not left accessible to those who might misuse them?
I would imagine most people after surgery aren't remotely aware that they could become dependent on these medications. So that's the first thing, to know that. And then to know that there are other medications that could be used a lot of times. But if somebody does have leftover medications, many people use 0 or 1 or 2 of these pills, or 5 or 6, and have leftover, and they're in the back of the medicine cabinet. Those can be safely disposed of. We don't recommend dumping them in the toilet or in the garbage, because they can leach into the environment, and they are in our aquifers now. Mm-hmm. But there are products that are readily available in Hays. You can get something from Walmart. They have an envelope that you can purchase for $4, and that would accept a number of pills or liquid, or these fentanyl patches can be placed in there, and then they are destroyed in the envelope. They're not available to leach into the environment. You can also purchase from Walmart.com a little packet of powder that can be dumped into the pill bottle with the pills. Add a little water, shake it up. In 5 seconds, that is a solid gel, and the opiates cannot be extracted, and they can't leach into the environment. Again, that's at Walmart.com. It's very reasonable. It's about $1.50 for one of these little packets.
Wow. So Walmart has taken really the lead, if you will, in trying to address the profusion of these available pills.
They have, and actually all of the pharmacies have started initiatives really just in this last year. And so that Dillon's has a program, Walgreens has a program, Walmart has a program, and Hays Medical Center Pharmacy is looking at things that they can be doing. Mm-hmm. The Sheriff's Department on 12th Street has a mailbox type installation where people can deposit unused, unwanted old prescriptions for safe disposal. And there's one also at Walgreens.
I've seen some of those locations, and of course there is the drug return program that's available. Law enforcement focuses on that once or twice a year, I believe, where people can do that. But again, there are other means of disposing of these, particularly with the little packets that actually make the drug, the remainder that you might have in your medicine cabinet, unusable. And this would work for not only the opioids, but other pain medication that you might have taken in the past or might want to get rid of.
Correct. And there's other medications besides opiates that can be a problem. Sleeping pills, benzodiazepines, Valium, or Ativan, lorazepam, Xanax, alprazolam. These are also dangerous medications and can be discarded there, or any old prescription can be deposited into these boxes at Walgreens or the Sheriff's Department, or placed in the envelope available at Walmart. Mm-hmm. And again, the powder is called Dispose RX, all one word. Mm-hmm. And if you Google that YouTube video, there's a little 40-second video showing how that works. It's very neat.
Wow. Dispose RX, and it's through Walmart.com. On the web. Speaking of online, this impact, we talked about age groups, and so many age groups are involved in the problem area of opioids, but there are some things that present a very telling description of what can happen to people. Talk about that for just a moment. That's available for any of us to watch anytime we want to.
There's an initiative called The Truth, thetruth.com, and it was started with cigarette companies that settled with the attorneys general with this massive settlement in 1999 for cigarette and nicotine addiction. Currently, they have thetruth.com. There are videos that will educate and counter advertise the real risks, the real truth about nicotine, about vaping, and about opioids. And one of the stories, they have a variety of things, but something you can see right now is something called Rebecca's story. And Rebecca is spelled with 2 Ks at thetruth.com. And you'll see a story of a 14-year-old girl that was dancing and twisted her ankle and started taking prescription opioids and ended up on heroin. And it's just compelling. And she will share her story and share her treatment and withdrawal in the video. It's a short video, but it does speak volumes about what can happen to our youth and what we can do about it.
This is something that you mentioned is, and I've heard of this, that is on display in New York City, I believe, in a location right in the center of a high-traffic area.
Correct. So this young woman was brave enough to share her story, but she's emblematic of thousands or millions of individuals that all have their own stories, but ended up in her case, the very innocent beginning, ended up with heroin addiction, and her journey, and she's sharing her journey of recovery with a multimedia video presentation. She's in a glass box and she's going through withdrawal in public to help people understand her story and what this is all about.
And this website is thetruth.com, is that correct?
ThetruthAboutOpioids.com. If you Google anything like that, I'm sure you'll find it.
And this is from a company that was formed with some of the subsidy money that was part of the lawsuit when cigarette companies were sued for their misadvertising and
that's the start of it. 20 years ago, 15 years ago, almost 20. And now it's supported by government funds and public health initiatives. And that, yes, that was a major component of that settlement, that Big Tobacco would support this, would support revealing the truth.
Now, we've talked about HaysMed's role in addressing the issue. We've talked a little bit about the patient's role in this. What other areas do we need, for example, pharmacists and pharmacies? Are they on board? Are they getting on board with the pharmacist? Often the person who knows most about what medications we're taking in some instances.
Yes, they are. I've spoken to each of the major pharmacies in this last week, in fact, and in some cases was surprised to learn how much of a program they have developed. For example, many of them have a detailed step-by-step program for the pharmacist to help his or her patients. And so the pharmacists are looking for people that might need advice. And you can go to your pharmacist and get advice about this. And I think they are excellent sources of information. Their goal is to keep you safe. It's a professional responsibility that your pharmacist and your doctors take seriously. And you can certainly approach them and get some advice about this. And a lot of times they have solutions.
Let's go to the patient once again. A person who is currently taking an pain relief medication, an opioid, or some other type of pain relief medication, and they feel like maybe there might be a problem what's the next step for them to do? What avenue should they open to get some help?
If someone is aware of somebody that may have a problem, and if this is there are facilities available in Hays. People can go to Smoky Hill, to Dream Incorporated, to High Plains Mental Health, and they all have knowledge and expertise. You don't have to figure this out on your own. You don't have to go through it alone. There are people and places where they know how to deal with this, and they can get you started, support you, get you into the best available care, and we have access to all of the best care in and around Hays. And finally, there's a larger facility in Salina at Central Kansas Foundation. So very locally, we have all kinds of help for those individuals that they feel they might need that. And then I think just approaching your physician or your pharmacist perhaps, or going online and looking at Rebecca's story, looking at thetruth.com. You can YouTube the Dispose RX. There's all kinds of things you can learn fairly easily these days. But your physician is there to help you as well.
And for those, we have a lot of folks who join us on KVGB in the Great Bend and Southwest Kansas area. What resources are you aware of that might work for those people in that particular area that might not have ready access to the facilities in Hays? Are you aware of any help areas, or are there sources, again, primary care physicians in Southwest Kansas and Great Bend and so forth that can help as well?
Yes, when I've talked to Dream Incorporated, to Smoky Hill Foundation, to Central Kansas Foundation, they have offices throughout Western Kansas. And there would be other offices, I'm sure, that would be able to help people in those areas. I'm not as intimately familiar with what may be available in the Great Bend area. And I think this is very much a situation that's developing rapidly. The crisis came on gradually, if you like, but like all crises, they grow steadily, and then all of a sudden there's an awareness. And it seems to happen suddenly, but it really isn't. And the response takes time to grow, but there has been a dramatic, since 2016, I would say. And so every day there's new things happening to help people, new awareness, more education. And I hope people keep their ears open and start to learn about this.
Well, and that's one of the reasons that I'm so glad you were able to give up some of your weekend to come and join us today to talk about this, to raise the awareness factor. Dr. Steve Waring from Hays Family Practice. We're going to open the phone lines. If you have a question you'd like to ask Dr. Waring that I've not addressed yet, or that you'd like him to repeat, please call us at 785-625-1114. And this is an information program. You don't have to give your name. But if you'd like to ask Dr. Steve Waring from Hays Family Practice a question about opioids or about drugs, addictions, and potential problem areas, here's your chance to call. Lines are open. If we happen to be on a particular topic, we'll certainly interrupt our discussion for your question. You don't have to give your name, but if you have a question about opioids, addiction, whether it's youth, adults, children, whatever the case may be, here's your chance to ask Dr. Steve Waring a question on health information, please, on KAYS, KVGB, Eagle Community Television, HaysPost.com, and the Google Play and iTunes app stores, 94.3 KAYS. Dr. Steve Waring is our guest. Lines are open. Call now if you have a question about opioids. The next area that I'd like to have you address, if you would, Dr. Waring, is recognition. Now, we talk about individuals and patients. What about someone who observes a family member, a parent who is observing a child? Are there outward signs of addiction that could raise a red flag to those caregivers or those people who are concerned about the well-being of other individuals?
I think this can happen in many different ways, but as for a parent and observing a family member, I would say if you observe that the painful condition hasn't resolved in the time that was expected, that would be a time to start asking questions. And I think in the past it's been the easiest thing to do is just to get more of these medications and refill them, and hopefully that's not going to happen as much, and that we would find some other way to deal with this.
And possibly pharmacies would block the refilling of those, or the primary care physician or the surgeon or whoever it might be, their office might block the refilling of those without careful examination then.
That's a very interesting point. The CDC is currently recommending that postoperatively we prescribe enough pain medication to last for a maximum of 3 days. That's the current standard of care. And in no case should we prescribe more than 5 days supply. So some pharmacies have picked that up and won't fill more than that. For people that have chronic pain, the pharmacies and Blue Cross Blue Shield and Medicare are looking at the risk of death starts to go up. The incidence of death per 1,000 people can be 2 or 5 per 1,000 for doses that are commonly used for chronic pain. So pharmacies, Blue Cross Blue Shield, Medicare are starting to require extra paperwork, prior authorization it's called, for folks that are taking more than the equivalent of 90 milligrams of morphine per day, which would be, for example, 6 Percocet tablets a day. Or more.
What about as far as accessibility for young people, Dr. Waring? You mentioned those pain pills that are in the back of the medicine cabinet that you might not even be aware of. And the accessibility of those. Is there something that presents to young people, you think, that starts this process of taking those pills?
So we've talked about children, teenagers, young adults that have surgery and get post-op prescriptions as potentially being a problem in a small number of cases, but not small enough. But we're also seeing, I know this is happening in Hays from talking to young people at a party situation at the university, perhaps the high school. I can certainly confirm the university party. These pills come out, they're available, and they've been accessed from someone's medicine cabinet, a friend, a family. They have a name on the bottle. And these are available at parties now in Hays and across the country. And there's a very dangerous dynamic. So that's one of the situations that we can all help. It's not like our pill in our medicine cabinet is going to be the problem, but statistically there's an incidence. So if we get them all out of there, that's going to cut that down. And we all need to do what we can to help.
We have some time left, and I want to make sure that we get to topics that you have addressed, because you've been working on this issue for quite some time now in association with HaysMed and with some special directions that the HaysMed Foundation is also involved in. Talk about that for just a moment, would you?
We're just starting to work with the foundation, and they have indicated a willingness and an eagerness to help. And I don't know what shape that's going to take yet, but they're very able and compassionate body that has done so much to help the community. And so I'm hoping that with the help of the foundation and others perhaps, that we can do more to make some of these powders available more widely, to perhaps make more of these permanent installations available for taking back medication. And that we can continue to make people aware. The hospital has over 1,000 employees, and we're uniquely, because the foundation is uniquely positioned to, they publish a newsletter quarterly that can just help to start to educate people along the lines that we've talked about today, but what can be done and what practical measures are available. And I'm hoping the foundation will help with that education process. Possibly we can do more in the community to make some of these products more available. Big industry has got involved in some cases. I'm aware of one large Fortune 500 company that sponsored 100,000 kits that would be available to the public, and they take the kit home and they can put all of their leftover medications in it. I don't know exactly what's in this kit, but I would imagine it's similar to what we've talked about to get these medications out of the community. So I think there's a lot we can do. I think the foundation is going to be helpful. We just haven't made any firm plans yet, but we are working on that as we speak.
Well, and the foundation has resources, and as you mentioned, with 1,000 employees at HaysMed, I can remember that this kind of an awareness factor with the flu vaccines, for example, preventing the common cold type things. It's been a gradual process and expanded tremendously over the years thanks to the involvement of people.
You mentioned influenza. That in our community, thanks to the foundation, Hays Medical Center, pharmacies, education, the general public, we now have a situation, if the influenza virus tries to come into our community and get into the first person, before it can get to that person and multiply to 10 people, 100 people, 1,000 people, it's going to run into someone who's been vaccinated, fortunately. And we vaccinate at our drive-through clinic at Hays Medical Center. I believe it's around 2,000 or 3,000 or 4,000 people every year, and the pharmacies contribute, I'm sure, an equal amount. So we really limit the ability for that virus, which is super contagious and deadly. It kills more people in our country every year than AIDS. It killed 160 children last winter. And now, thanks to education and support and the foundation and pharmacies and others, we can make a real dent in that.
And it's still not too late to get a flu vaccine for this year.
Correct. The flu season is not over, so it's not too late. And they're widely available. You can get them at your pharmacy, and many times for free. Ellis County Health Department has them. Your internal medicine and family practice doctors will stock these. We use high-dose vaccines for people over 65. We also have pneumonia vaccinations that we give to anyone over 65, 2 different ones. And anyone who has a chronic disease that is younger than 65, like COPD or diabetes and other conditions, we vaccinate for pneumonia.
And there's also the availability of the shingles vaccine as well in the 2 separate doses.
Correct. The shingles vaccine was renovated. It's a new product in the last year. And anyone that had the old product, we recommend they get the new product. It's more effective. The old vaccine gave you a 50% improvement. You were 50% less likely to get shingles. The new one is over 90%.
Wow.
So it's more effective. It is 2 doses. Anyone that's had the old vaccine, anyone who's had shingles, should go ahead regardless and get the new vaccination. Right now, it's a little bit out of stock. It's back ordered a little bit. Has been for a while. But I think that the supply is actually coming back right about now. I think Hays Medical Center is going to have it available this week, next week. And I don't know where the pharmacies are at, but you can certainly go to your pharmacy, get the vaccination for shingles. And if it's not quite available, they'll put you on a waiting list and call you when it's in.
And your area health department, your county health department also can help with the information on that, a 2-step process for the Shingrix improved vaccine, I guess we could say. And Dr. Waring, we have about 3 minutes left. I'd like for you to repeat again the availability of disposal methods for those opiates, other pain medications, other prescription drugs that you might have in the back of the medicine cabinet. Deal with those.
Anyone who has medications in their medicine cabinet that they'd like to get rid of can pick them up and carry them down and deposit them into a metal container during business hours, Monday to Friday, at the Sheriff's Department on 12th Street, or at Walgreens Pharmacy in their deposit, which is available during store hours 8 a.m. to 8 p.m. Monday to Friday, and I believe 8 a.m. to 6 p.m. Saturday and Sunday. They can go to Walmart and purchase an envelope, which is called Deterra, $4, and that will handle a large number of pills, liquid, fentanyl patches. Or go to walmart.com, purchase the powder, Dispose RX, six packets for $9, so it's cheap. Or talk to your pharmacist or your physician.
But the point being, make a move to try to reduce the availability of these prescription medications, which you may not even be aware that you still have left, but to look and find them and dispose of them properly.
Yes, and again, 1 out of 7 of our high school seniors have used these prescription opiates in a non-medical fashion in the past year.
1 out of 7 just in the past year, and many times, as you mentioned earlier in reference to some of the university student situations, these are coming from former prescriptions that are being misused in a recreational form.
80% of people who use heroin 80% of these people started with prescription opiates that they obtained from a friend or a relative.
And for further information about that video, Rebecca's story, what is that website again? The Truth?
Opioids.thetruth.com.
Opioidsthetruth.com.
Correct.
Okay.
Rebecca's story, Rebecca with 2 Ks.
And again, for further information about this particular topic, talk to your family physician, your healthcare providers, or your pharmacist.
Yes, please.
Dr. Steve Waring, our guest today from Hays Family Practice. Thanks for joining us today. We'll talk about sleep next time.